Dina. I'll be your nurse today.
Hello.
To provide you some privacy. How are you feeling today?
I'm okay.
Oh, can you please verify your first and last name for me?
Jane Doe 109XX.
And your date of birth. Thank you so much. And do you have any allergies, Jane?
No, I don't.
Okay. So I see here per my provider's orders you're due for a trach suctioning. Is that correct?
Yes.
Okay. I'm going to go ahead and assess your lungs and listen to how you're feeling. So if you can just breathe normally for me. Listen posteriorly. Okay, so I definitely hear some crackles. Could you try and cough out any of those secretions for me on your own first, please?
Not really.
Okay, good. So we're going to go ahead and move forward with the procedure. So we're going to turn up your oxygen up 2 liters from where you were at. We're going to turn on your suction. We have your suction right here, ready to go. Now we're going to begin the actual procedure. Let's open that and throw our saline in here.
Put him back in bed.
And perform hand hygiene.
Oh, that? No. Yeah.
As long as you like
Okay. So we're going to go ahead and grab this tubing with our dominant hand, making sure that we keep it sterile all throughout the procedure of the suctioning. Then we're going to grab this with our non-dominant hand, our dirty hand. Place that on there. Okay. Remove the patient's oxygen, but not prior to first checking the suction in our saline. And we are still okay maintaining sterility. We have not touched our tubing. So check it in there. Okay. So we're going to go ahead and remove the oxygen. We're going to go in 6 to 8 inches. Go ahead and inhale for me. Okay. And then going out intermittently, we're going to pull this out. Okay. Then we're going to go ahead and place the oxygen back on our patient. We're going to suction that again. How do you feel, Jane?
I feel a lot better.
Okay, we're going to go ahead and take one more listen to your lungs.
Okay.
And we are also monitoring for signs and symptoms of hypoxemia, and we're measuring her pulse rate. Lower. And posterior. Okay. You do sound a lot better. So at this point, we're not going to suction again, but if we were to, we would go ahead and assess with the patient or ask her one more time if she found it appropriate to suction. But since she won't, we can go ahead and discard our supplies. So we'll toss our gloves. We don't need our basin anymore. Okay, so at this point we can turn off the suction. And we have monitored her pulse ox, and we're just gonna let her oxygen rest on her because she may have been in distress from the procedure that we have just done. So we're gonna let that sit for several minutes. Now we're gonna perform hand hygiene again, and we're gonna move on to the next part. Okay. All right. So we'll don our gloves. Alright, so we have our saline here. We're going to open that up and pour it in the two compartments that we have. We're going to move this a little closer to us. So we're going to move her oxygen again, making sure not to touch the inner part of her cannula here or her trach. We're going to put that in there and let that soak. Now we can go ahead and become sterile. So we can make sure that we have performed hand hygiene again. We have our sterile sheath here.
You're welcome. Bye. Tomorrow.
Okay. We're going to make sure that we work within this area. So we're still maintaining sterility. We're going to clean this off. And then we're going to place it and rinse it in our clean saline compartment. We can go ahead and toss that. Now we are no longer. After we have tossed that and placed that in there, we're going to go ahead and place it back in the patient before we become not sterile anymore. So we maintain our sterility still. We can go ahead and place it inside. And we heard the click, so we know it's really in there. And now we can go ahead and clean around her stoma. So now we don't have to be sterile anymore. We can go ahead and remove this while assessing what the stoma looks like right now. It looks appropriate for her skin color. We don't see any redness or abnormal drainage. So we'll go ahead and clean. We have an option if whether or not we want to wet these or not, but I won't for this procedure. So we'll just clean around her stoma. And while we're doing it, we're gonna go ahead and assess for if she does have any drainage around it, the color or consistency, if she has any irritation, bleeding. She does not. We're gonna toss that. And just to make sure that she is extra dry around there, we can pat dry around the area once again. And we can put on her new dressing, her new gauze, I should say. Then we have our trach ties. We're gonna have her assist us in lifting her head. Thank you, Jane. And then we would replace them before we remove the old ones. So we've replaced them, now we're removing these. How do you feel, Jane?
I feel a lot better.
That's really great. So upon finishing everything, we're gonna listen to her lungs one more time, giving her her oxygen. We don't need our gloves, so we can remove them. And then we go lower into the lower lobes here. Listen laterally and posteriorly again. And she does sound much better and clearer. So I would document how she tolerated the procedure, how she's sounding right now post-procedure, as well as the consistency and the mucus color that she may have coughed up or that we had cleaned up, and any drainage around her stoma, how it's looking now. And we would go ahead and turn down her oxygen back the 2 liters that we had hyperoxygenated her to before. And lastly, we would just make sure that we perform our hand hygiene again and discard our supplies. And we're gonna go ahead and lift up our bed rails. Put her call light next to her, and she's good to go.